Hey Amanda, it's good to see you again this week for our second session. How are you doing?
Good. How are you, Sylvia?
I'm well, thank you. Looking forward to unpacking a bit more.
Yeah, me
Um,
too.
this week, I thought it'd be good to talk about a care plan and so what a postpartum care plan looks like. Last week, we talked about what depression, anxiety, and obsessive compulsive tendencies can look like for postpartum women. And the idea came out that it looks differently and to intuitively trust ourselves if something doesn't feel right. And then this week, our care plan can also look different for everyone. What you find as self care or what you enjoy to re-energize is going to be different to me. It's going to be different to someone else. So I thought we would spend some minutes on that. And yeah, again, thank you so much for doing this.
Thank you for including me. Honestly, I'm so happy to be here and I'm very excited to dive into this with you.
All right. So let's get started. I'm just great. So actually, let me just present here. Okay, there we go. So self-care or a care plan. Um, so in this, with this particular topic, um, we hear a lot of things that we should do after we've given birth. And that word should can sometimes be a little bit dangerous because it really brings up uh, a bit of some anxiety or thinking traps. As a new mom, we think, oh, well, the nurse said I should do this, or my mom said I should do this, or I saw that my friend was doing this, maybe I should do that. And so switching that narrative, making that shift to, well, my friend did this. What would it really look like for me if I did that? And maybe there's something else that I need to do. So looking at the narrative, our thoughts, which then equate to how we feel. Um, we're learning as a new mother. We need to consider what we need versus what we should be doing and kind of filtering out the voices that come in. Can you speak to that?
Yes, I would completely agree. I think the shoulds are so dangerous.
Mhm.
In my own experience, even with my son, I did not struggle with my mental health, but I remember having so much pressure on myself because my mom did this, my mom did that, I
Right.
should do this because she did that. And I found myself in a spot where I was so miserable and I was really just not enjoying being a mom at all. And I remember thinking, like, am I a terrible mother
Mhm.
for feeling this way? And am I like, maybe I wasn't supposed to be a mom because, my mom loved rocking me to sleep for hours and hours. Well, so she said. And I was hating it. My son was like 10 pounds when he was born. To rock
Oh,
him for
wow.
hours and hours, like it was an arm workout.
Yeah.
But so I do remember the shoulds really getting in my head. Even with breastfeeding, you should be breastfeeding. My
Yep.
friends were breastfeeding. Whoever was breastfeeding. And I was really not enjoying breastfeeding. And like those things they can like make or break a mom's experience.
Mhm. Yeah.
And they can really send you down a dark hole really, really quickly if you feel like you should be doing all of these things and either you're not enjoying them or you don't want to do them. And then all of a sudden you've like labeled yourself as a terrible mom.
Yeah. It comes down to kind of restructuring what we need and giving ourselves permission to take care of ourselves or allowing trusted people to come in and help us with that
Yes.
care. One of the things that has been interesting in postpartum maternal mental health that I've learned through clients and I've learned through myself is that yes, we have those 3 trimesters, but we also have what's called a fourth trimester. And that fourth one, we touched on it last week of that those first 3 months postpartum can be really dark. And it's the time when we really need to have that and then almost embrace that as a transition period, almost as like an outpatient period,
Yeah.
if that makes sense. Um, and considering that we need help then. Not only are we adjusting to this new little person that's in our life, but just our bodies, the aches and pains that we feel. We've just given birth, repairing from that. It really is such a critical time that sets up the rest of the maternity leave. Um, so really important to become like what we see here on the slide, like a well woman or a well person, whatever you want to label it as. But it's not just well mother, well spouse, well household manager, well professional. Some people don't even get a maternity leave, but it's identifying who this new you is with the help that you allow yourself to have in this care
Yeah. And I think it's really important to pick your help wisely, if that makes sense. Like, I feel like the first time when I had my son, I kind of let everybody come in, everybody give
plan.
me their opinions. Um, it was so much, it was so overwhelming. Whereas when I had my daughter, nobody came to the hospital.
Mm.
Nobody came to my house right away except for the grandparents. And I had like selected who I wanted to be involved with me for the first few weeks because I learned how hard those first few weeks can be and how overwhelming they can be. So it's really important that you choose wisely who you want to help you because everybody's going to give you opinions and tell you what worked for them and like we said before what you should or shouldn't be doing, and it's really truly not helpful.
Yeah.
The advice is wonderful and I don't think anybody means harm by it, but it really can cause a lot of harm. It did for me anyways.
Yeah, I like how you said that. The advice can be, I know it comes from a place of love and care from people, but it's like any other thing in life. Like you take it, you filter it, and make it work for you, especially during a time that's so vulnerable.
Yeah.
I'm just going to move this little window here and just allow people to see the title. But what is changing and what are women adapting to postpartum, which can really dictate what kind of care we want? I had mentioned just a few minutes ago the pain. That's one thing I remember with carrying my child in the car seat, just constant tension in the shoulders, a lot of
Mm-hmm.
lower back pain because you've carried this bump for 9 months and then all of a sudden your body has to adjust, your spine's adjusting to readjusting, if that makes sense, to what you were before. I mean, and just even physiological issues that go on, like incontinence and having to go to the bathroom other way, or just a lot there to consider. Um, One of the things that I really appreciated was just even pelvic floor muscle work.
Yes.
Seeing a therapist for that because we don't consider these things. Again,
I
part of
know.
the care plan. um, Looking at care plan with social interactions. Like you said already, who are those people we're going to let in? Do we want kind of critical, overly advicey people? Or do we want people that are just going to be there to support us and kind of see what needs to be done and go for it? It's a hard balance because we don't want to offend those people that want to help, but we also want to make sure we're taking care of ourselves mentally with the types of social stimulation we bring in. And then emotional, it's so confusing. It can be overwhelming, and there are a lot of lows that come with it too.
Yeah. I when you were like saying the physical things, it was like bringing me back. And I remember like physically, I had a C-section with both children. The
Mm,
first time around was especially hard since I didn't know the aches and pains, what was normal, what wasn't. And I had such a hard time to actually get up and walk when I was in the hospital. And I just remember like having to adapt to like allowing my husband to help me with things that
Oh,
I feel like I never thought I would. And it was great. Like he was super supportive, but it was just so different to have to rely on your husband to like physically help you get around or help you into the bathroom, or you're kind of like allowing your guard down so much as if you already haven't when you've given birth. But that can be really hard. And like the body image issues was a big one for me too. Like it's so hard at first to feel sexy, period, when you've just had a C-section and you've still got like a squishy tummy and
yeah.
you've got big boobs full of milk. And
Oh,
right, and like when your milk first comes in, it's like the most uncomfortable anyway. So it's so important to allow yourself to give the healing time and try and be kind to yourself, because I think another thing we don't realize, like, your body took 9 months to make that baby, and some women just think like, aren't I supposed to walk out of the hospital with my pre-pregnancy jeans?
yeah, no.
And when we don't do that, we can be so hard on ourselves. And it's really, there's no need for it. Like your body takes so much time to heal and go back to pre-pregnancy. And the social aspect, that was a big one for me too. Like I said, I allowed too many people into my
Mhm.
bubble, and it was incredibly hard. I felt like a totally different person. I had my friends over and I felt like I couldn't relate to them, or they didn't relate to me. And
Mm.
I felt really guilty if they wanted to kind of overstay their welcome, because I really wanted them to leave because I was so tired. So when I had my daughter, I did put up a little bit more boundaries, but that did feel more lonely.
Mm.
So it is a hard, it's like a really hard in between to find where you want the support, and maybe to not allow yourself to feel so alone, because that time can feel alone. But then I also felt like when I had my friends around, because they couldn't relate to me, I still felt alone, if that makes sense.
Mm. Yeah, I understand that. And it does make sense because you want the space. You use the word boundaries. What a time to create them, eh? When
Yes.
what you need is support and you want encouragement, but there's a certain line um, in the boundaries of who you want around. But how do you articulate that when you're trying to just, try to get up in the morning? And if you're breastfeeding, it's like, I always remember waking up and like your shirt is just wet of like
Oh,
milk.
yes.
And it's like, who's coming over today? What? I need to take care of this shirt right now. Um,
Yes. Or like,
Sorry, Amanda, you cut out there, but hopefully we'll get some sound. I don't know if any you can hear me. Can you hear me right now? Yeah. Okay. I think you're coming back. I think I
I'm
hear
coming
some.
back.
There you go. There you go. That's okay. It's live, right?
Oh, yeah, this is
um,
the lovely ways of our world.
yes, right. I just wanted to just pause a moment, Amanda, if it's okay with you, when you use the word boundaries. And one of the
Mhm.
things that I've been learning in my psychotherapeutic training is, um, you know, boundaries are kind of sometimes really rigid, and sometimes um, we want to change those boundaries, and it's almost like we want to have more limits. And sometimes just even the wording that we use can help in our postpartum care. Like to say, this is where I'm at right now. Um, uh, Today I'm feeling like this, so I need to have this. Or, I really appreciate you trying to create that plan for me, like if you want to go with friends, but I'm kind of doing things day by day. And I think those words can be empowering for women because we don't know sometimes how to articulate what we need because we're worried about hurting other people's feelings. So when we say even boundaries or limits sometimes feel like they're a little more fluid. Um, so empowering women to say what they mean in a way that is coming from them. It's not about the you, it's the I. I need this.
Yes.
I hope for this. So I just wanted to bring that up because sometimes women will say, well, how do I say that to my mom? Okay, well, let's try this. Let's role play. So I wanted to bring that up because I really like that word, boundaries. And then you also use the word healing. And I love that. And like that fourth trimester really is about healing. What do you need to heal? Do you need to heal your lower back? Do you need to heal your soul, your psyche? What nourishes you? Um, what is your purpose right now? Because purpose can be dynamic. My purpose right now is to heal and have a care plan.
Mm-hmm. I love that.
What can be included in the postpartum plan? And I kind of highlighted in capitals, what do you need? We talked about at the top of the session, what you needed, Amanda, postpartum is going to be different from what I needed.
Mm-hmm.
I'm wondering what were your needs? Like now that you look back, maybe what you would have liked more, or what really soothed you, what nourished you during that time?
So, to be honest, I don't think that I was honest enough with myself about what I
Mm,
needed, or my husband, or anybody. I was doing the like super mom fakeness. I don't know
yeah.
what else to call it, the facade.
Mm,
Um, I did not realize how hard it was going to be to transition from one child to two. I didn't give my toddler the power he deserved. It was like I just thought I was going to be able to do this because I had a newborn before,
mhm,
but I've never had a newborn before that kept me
yeah.
up all night with a toddler
Mm,
who was awake all day.
mhm,
So I think if I would have made myself a postpartum plan,
mhm,
I could have thought this through a little bit more. I think if I would have been more open about what I was missing, which was I felt unsupported, I felt
mm,
exhausted,
yeah.
but I didn't ask for help. Anytime somebody asked me if they could help me, I said, I've got it. I've got it handled. And if I have my husband, we've got this. We're a team. But we were also a very exhausted
Yeah.
team. So we needed a third person or a fourth person or whatever it was. We needed to put my son in daycare before the time that we did. We needed to allow the grandparents to take my son so we could get some much needed sleep during the
Mhm,
day. My husband was very supportive. I was very clear with him about my needs, but I
oh, sorry, Amanda, you cut out there. Can you hear me?
yes, I can. Can you hear me?
Okay, now I can. Yeah.
Our internet connection is not loving us today.
Yeah. It's okay. We'll keep going and see what happens at the end. But sorry,
Yeah.
is it okay if you just kind of revisit what you just said in case we missed it?
Yeah, so I just want to make sure that everybody understands to be very clear with your spouse and
Yep.
don't be like passive aggressively clear like I
Mhm,
was.
yeah.
Don't make assumptions. I think we assume that they should know what we need. They don't. And like I love your whole, I've been really having a lot of conversations with other practitioners about this postpartum plan. And I think it's huge to have these consultants and
Mhm,
breastfeeding support, like a lactation consultant,
mhm.
have a therapist, have all these people, like have all the phone numbers that you need so that if and when something does come up, you already know where to go.
I think these people too um, are encouragers.
Yes,
Um, we also, I think, and I'm going to just be direct, I think we need to humble ourselves to
we
say,
do.
I can't do it all. I need the encouragement to breastfeed if that's what you choose. Or I need the encouragement to say, I'm not going to breastfeed, and there's another way to feed my child and work through that because that narrative is really strong too.
Yeah.
You need to breastfeed. And yes, there are those benefits to that, but again, everyone is so different. Pelvic floor specialist, I must say I worked on that, and I got a lot of help with that, and that was wonderful. Again, in recovery, getting back to what this new me looks like.
Yeah,
And these people, this is what they do. This is what they want to do.
that's right.
And they can help us. So humbling ourselves to have the courage to say, oh yeah, man, I need help. Like when you said that you and your husband were an exhausted team, and that's two people.
Mm-hmm.
That
We
whole
couldn't do it.
idea, right? It takes a village. Huge, huge idea.
Yeah. And I like what you were saying about the breastfeeding support, and even like something that we think is as simple as breastfeeding, because I think we just think it's simple because we're moms and we have boobs, so we should just be able to do it.
Yeah, yeah.
And I did do it a little bit with my son, but I remember thinking, am I doing this right? Is he getting enough? And like that alone can be exhausting. So even if like you feel like you're doing okay with breastfeeding, like it's still okay to check in with someone to make sure you're doing it correctly. Or if you, I know that there is lactation consultants that help you with bottle feeding. If
Yeah. Um, you cut out again. It's like when you're saying all these wonderful things and then you cut out.
right.
The last thing I heard was bottle feeding.
So no, I did speak with a lactation consultant on my podcast, and she was saying like, it's great when moms can come to me and they realize I'm not a judgment, like I'm not going to judge
Yeah.
them. If you want to bottle feed, that's great. Let's have a conversation about combo feeding or bottle feeding, and let me
Mm,
help you with the right bottles, and or even the transition. Like, so I think this big fear that you're going to be judged as a mom if you
yeah.
go to one of these specialists. It's not true. Like, no one is there to judge you. And if you go to this breastfeeding person and they're like, oh, you're killing it breastfeeding, or if you go,
Yeah. Can you hear me now, Amanda?
yes, sorry, you
Okay.
froze. I couldn't hear you or
Okay.
see you for a minute there, but now
Okay.
your screen's back too.
Yeah. Yes.
But yeah, I just think like if moms can really work through the fear of judgment too and just get help, and then if they figure out that they're doing everything really great and they don't need help, then that's okay.
Yeah. Yeah. It really comes to encouragement and trusting yourself and humbling yourself to say, yeah, it's okay. It's fine. And filtering out those narratives. It's hard. It's really hard.
Mhm.
We're talking about it, and we do want people listening to know that it is difficult, but it's possible. It really is possible. And it really takes a load off your shoulders. Um,
Absolutely.
one of the things I wanted to include this slide because as much as we're talking about all this, yes, there are costs to it. But I
Mhm.
also think that there are supports and resources. I know there's a breastfeeding clinic at the hospital I gave birth to. I did also have the opportunity with my second child to go. For my first child, I had an OB. My second child, I had a midwife. Very different approaches to maternal care. It's whatever fits with you. My second time around, I was privileged enough to have a doula. Again, that has a cost, but some of the best money I've spent. So like, again, it's doing all of that research. What do you want your care plan to look like? Um, with the Compassion Project, where I'm doing my internship right now, we do offer pro bono services and we offer sliding scale. So putting it out there, there are other agencies to have that. So again, putting that in place maybe before you're in that fourth trimester. And if not, finding people who can help you.
Mhm.
Um, being that voice for yourself. Um, as women, we're taught to push through. You can do it. Don't just suck it up kind of language, not conducive to allowing yourself to get help. So I guess what I'm saying there is find the resources that you need and find the people who can help you help you.
Yes, that's very good advice. because it's hard to know where to go.
Absolutely.
And I
It's
think the hardest
intimidating
part,
too. Yeah, sorry,
yeah,
go
and I
ahead.
think I know, and I that's okay. And I think the hardest part is like looking for the help too. So if you already know where you can find it, then you might not be so hesitant to call.
Yeah. So, what can it all look like, and what do you need? Sometimes with postpartum care, self care, care plan, all of these care words, it's enjoying building in time, like 30 minutes a day, if that's possible, to even just feel like you have a facial routine or read a chapter in your book. Um, Talk to that friend that you really appreciate, listens to you. Uh, Different for everyone, but when you take care of your needs, you're taking responsibility for yourself. And think about what you're also teaching your children as they grow up, that
Hmm.
you are showing resilience in such a time that can be really hard, but you're being responsible for yourself. And that is being courageous and being the superhero, real superheroes, right?
Oh my gosh, yeah. And I love what you wrote here about like getting dressed and doing your hair. I cut off all my hair so that I would actually have to start doing my hair because it was so easy to just put on a pair of sweats and throw my mom bun in my hair.
The mom bun.
Yeah, and I think it's okay if you do that, but I just found for me, like forcing myself to get up and get dressed and wash my face and straighten my hair, I at least felt a little bit more human, even though like 10 minutes later I was spit up on or whatever. It just made me feel a little bit more like me.
Yep.
I made it absolutely 100% something I did at least once a week was I got out of the house by myself,
Mm.
which was huge. That didn't happen right away. That happened like through when I was in therapy.
Yeah,
But some days it was literally as soon as my husband walked through the door, I would hand him the children
yeah.
and off I went. Or sometimes it was I had a really great day but I was still like itching to be alone. So when they'd go to bed, I would go to Indigo. I would just go to Indigo, get a Starbucks and
Mm.
walk around.
Yeah, yeah. That sounds nice right now during this
Doesn't it?
pandemic.
I haven't done it in over a year.
Yeah,
It's
yeah.
one thing I'm missing, but you can do it with anything. Like
Mm.
you could just go for a walk around the block. Just your kids will not die if you leave them with
Yeah,
your spouse for half an
yeah,
hour, right? Like
yeah.
we feel like they might, but
When you said the indigo imagery and the warm drink or whatever and walking around, I was brought to an idea that we have in psychotherapy or in psychology, the idea of flooding and dissociation. And as women, I find through my experience and in speaking to clients that we tend to do a lot of flooding. So emotions all the time, all the time, all the time. And one thing I wanted to add with the self-care care plan is essentially that it's important for us to also have a bit of a mental distraction. So if you can have different stimulation and bring in the five senses and be mindful of what's going on, just to give your brain a break from what you're going through in life. Um, and with women, we tend to take it all and it's like this big overwhelming wave. So the distraction is actually good. Dissociation is almost the complete opposite. It's complete distraction, not connecting with our feelings. But women
okay.
tend to be a bit of the opposite. So when we do these care plans, what also allows you to distract a little bit so that when you come back to your life, you feel not only refreshed in your body, but you feel refreshed up here because you've had that break. And the five senses are a really good way to incorporate that.
That's really cool. That's interesting. Thanks for sharing
Yeah,
that. I
yeah,
didn't know that. Makes sense.
yeah, yeah.
Totally.
Um, Anything else to add, Amanda? I think we covered a good amount of a care plan and encouraging women to have that.
I I do just have like one thing that came to me when I was speaking with another mom this week, and we talked about like how we plan for Are you, oh, now you're frozen. I don't know if you
No,
can hear.
I can hear, I
Oh,
can
you
hear
can
you.
hear me? Fine.
Yeah.
If we're frozen, it's good. As long as you can hear me.
Yeah.
But when we get pregnant, right, we plan for 9 months for this baby. And I feel like your sole focus becomes the baby, and you have
Mm.
this birth plan and everything else around the birth that literally lasts for what? Let's just give it like 24 hours.
Yeah.
And it is a very big moment. It's so important to prepare for, but like nobody prepares for afterwards. Nobody prepares for breastfeeding that we're going to do for a year. Nobody prepares for your mental health state. Nobody prepares, everybody just is like, okay, you just push the baby out and then like you just go on with your day. And it's really not like that at all. So we really need to be very clear. Like a lot of women have no idea they need a postpartum care plan. And it's so important. I personally think it's almost more important than your birth plan, because your birth plan can go off the rails so
Yeah.
quickly.
And relinquish control there, right? Just
Exactly.
don't know.
Whereas your postpartum plan, you can have a little bit of control over. You can't control what happens postpartum, but you can control how you handle it. And, if I really think it would have made my postpartum so much easier, maybe nicer, maybe more smooth. Maybe I wouldn't have felt like such a failure, but
Mm.
I see those things now. So I just hope that if somebody's listening to this and they can really see, it would be just so important to have that plan. That would be my piece of advice for any mom.
Yeah. Yeah. Yeah.
Stop planning so much for the labor. You got to do it anyways.
True. Yeah.
Baby's coming out.
Yeah. It sounds like it's about, yeah, trusting yourself and advocating and knowing that you still have a voice as you engage in this new identity for yourself. Yeah.
Yeah. Agreed.
Amanda, thank you so much for this
Thank
second
you.
session. We'll plan for our third one and see what that looks like. But I really appreciate your insight, your the education you have this, and also the vulnerability that you're showing and sharing your lived
No
experience.
problem.
Yeah.
Anything I can do. I never want another mom to feel the way I felt. It was the worst feeling ever. And it's not fair that no one's talking about this. So I appreciate you guys for setting this all up, because it's going to help so many people.
Thank you so much, Amanda.
Thank you. Have a great day.
Yeah, you too.